Sweet, a source of happiness and pleasures, also come with a cost. Type 2 diabetes, affecting over 540 million adults worldwide, with over 6 million in Thailand alone, as of 2021. With poor treatment adherence, due to systemic and individual factors, can lead to complications including heart disease, nerve and eyes problems, and other conditions significantly impact the daily life for diabetes patients. We are Blue Horizon, providing an innovative solution to diabetes treatment adherence. But where in the world should we start?
In a world with many countries, which country should we choose? We will choose Thailand because we are medical students in Thailand, which make us familiar with the healthcare system here and aware of information that may not be readily available elsewhere. Additionally, we have family members who have diabetes, giving us insight into the real challenges faced by patients. Furthermore, we can develop our application for global use using Thailand as a model.
Why do some patients struggle with treatment adherence? Several factors contribute to this issue, interconnected in various ways. Limited access to healthcare facilities and public transportation forces the patient to travel into the city for medical treatment. However, not everyone had an access to private transportation, leading to the need for expensive car rentals and group travels with limited seatings and number of trips. Here we are at our main problem, the money. This study shows that almost half of diabetes patients in northern Thailand fall into low-income category, struggling to meet with basic needs and affording medical expense. Missing work and entering long waits at hospital are not feasible options. To address this challenge, the National Health Institute of Thailand proposed telemedicine with postal drug delivery, but its effectiveness is hindered by patient difficulty learning to use electronic devices and privacy concerns. Ultimately, there exists technological disparity between the impoverished and the wealthy, exacerbating access barriers to treatment.
As you have seen, many of the problems has been listed, and as an innovator, we have created an innovation by using a powerful idea called Otherwise Charter, a global agreement of health promotions. And as we are one of this world, so including the Sustainable Development Goals, especially for the third goals related to health and well-being. These two big ideas is the basis of how we're shaping our innovations under the visions of technology for diabetes people that is accessible, affordable, and appealing to use.
We proudly present Wan Noi. We selected a Thai name with 2 syllables to make it easy to remember. Diabetes in Thai is Bao Wan, so we picked up the word Wan, which means sweet, and combined it with Noi, turned it into Wan Noi, which means less sweet, cute and simple. For our logo, we use W from the first letter of our name and diabetes awareness symbols, which are blue circle and ribbon. Then we combine them together to create our logo, Wan Noi.
Our mission with this application is to make diabetes treatment affordable and accessible, with a simple mobile application with a voice-over function, features including medication reminder, blood sugar tracking, family support, and online community and counseling. And it's an appealing and reliable convenience for diabetes patients, with a user-friendly layout, while promoting medication adherence and facilitating connection to family and community support.
Let's take a look at your diabetes buddy Wan Noi. Available in English and Thai, we ensure accessibility to wider audience. Whether you are a healthcare provider or someone seeking medical assistance, Wan Noi is tailored to your needs. For general user, entering our homepage, you can find 6 main features. We design big icons and arrange them in the simplest way, so it would be easier for older users.
Introducing our first feature, self-monitoring. Designed to streamline your diabetes management, this feature offers a range of functions. Easily record your medications, earning 1 point per entry for our lucky draw every 15 days. Track your daily blood sugar levels with auto-generated graph. Monitor vital signs like body temperature, blood pressure, heart rate, and respiratory rate with corresponding graphs. And log your daily physical activities, all in one place.
Besides this function, one of our main features is a medication reminder. When your doctor prescribes medication, our apps record all necessary information, and when it's time to take your medication, a notification pops up reminding you to take them.
We also offer a caregiver features where caregiver can scan the patient's QR code to access critical patient information, including monthly medical history for adherence monitoring. If patient forget medication, caregiver receive notification to remind them by calling and providing the drug list. This feature enables family involvement in healthcare and fostering communication and assistance if medication is forgotten. And in addition, the QR code will be refreshed hourly for security.
If there are any questions that you want to know more about diabetes, we offer you a counseling function. Once you click on the functions, you can choose which languages would you prefer. And as our target country is Thailand, so we have been concerned about dialectical differences. So if you choose Thai, you can choose which vernacular would you prefer. There's been more than 100 common questions on the list, and if you don't want to read it, we offer you a voice-over icon that you can click on and we will read it for you. However, if your questions has not been on the list, we will lead you to a chatbot features and we will help you to find out more about your questions.
Next is the follow-up function of the OneNoise application. Schedule appointments are displayed on the calendar. If you can't attend, simply tap the reschedule button. The application also sends you notification reminding you before the appointment day. In the rescheduling section, you can tap to contact details for the rescheduling missed appointment.
This is support group feature. Support group is a community for diabetic patients and caregiver. You can scan QR code to join the open chat. Patients and caregiver can share their experience in managing diabetes for themselves and their families.
Now let's walk through our application as a healthcare provider. Our key features including using your occupation and your license number or your affiliated hospital for verification. Upon reaching to our homepage, there are two main functions which are viewing and entering the patient information. In addition, we prioritize the privacy and consent of the patient by requiring patient consent every time before inputting any information into our application.
Moreover, we provide dual data protection for patient privacy, user and password creation, and passcode requirement for each login. During registration, we collect patient data for comprehensive care, and our app serves beyond diabetes patients, aiding risk assessment, information access, and awareness raising for our user.
To summarize all of our functions, we have made them accessible to everyone, no matter of who you are or where you live. Our application is free to ensure affordability for everyone. We have designed our application based on user demand, prioritizing both functionality and graphically to encourage usage.
We have integrated rewarding system inspired by scanner operant conditioning theories for boosting patients' motivation for treatment adherence. Moreover, we also combine belief and behavior together. For example, the medications reminder. We mimic the morning greetings that commonly sent through elders every morning to keep in touch.
Affordability and accessibility. You can afford medical treatment and access information from your home.
We offer a community for you and your caregivers to provide mental support.
We make medical record keeping easier for you and your healthcare provider.
We will remind you to take medication.
We provide details on your appointment in case you are unable to go on that day.
You may win the rewards and achieve a good health, both physically and mentally.
We access this app based on affordability, accessibility, appeal, and effectiveness. Affordability is accessed by user download and registration, comparing with the total number of diabetes patients in Thailand. Accessibility and appeal by user satisfaction, and effectiveness through a retrospective cost study, comparing with HbA1c level and appointment attendance.
This is our 3 years plan divided into pre-launch phase and post-launch phase.
And lastly, this is our overall budget.
Accessible, affordable, appealing, OneNoise, your diabetes buddy.